Welcome back, Medicos. We all already knew that the government quota rank list and the management quota rank list in Tamil Nadu were not comparable. The different approaches used by NBE for preparing the All India percentile as well as the state percentile has led to a situation where the government quota rank list and management quota rank list cannot be used together, because a candidate higher in government quota rank list may be lower in management quota rank list. So it's very difficult to use both together. Now, what's the problem with this? The problem with this is you cannot have a common counseling. You cannot have a single counseling combining government quota seats as well as management quota seats. So it led to Tamil Nadu having two different choice lists. So a candidate has to fill a different choice list for government quota, a different choice list for management quota. Now in this case, Tamil Nadu has no other choice. If a candidate gets a seat in government quota as well as management quota, they have to give both the seats. They have to allot a seat under government quota as well as management quota. And then they have to leave it to the candidate to decide should they take the government quota seat or the management quota seat. Now, because of this, certain seats will be blocked in first round. Okay, it's not intentional, but a candidate will try both government quota and management quota. Whichever they get the better seat, they want to take it. Whether they want a better college, they want a better branch, we don't know. Depending on their choice, they may go with government quota seat or they may go with management quota seat. Now, if we had a proper rank list, this situation would not have arisen. For example, in Tamil Nadu UG counseling, we didn't have this problem. We don't have this problem of dual allotment, where a single candidate gets two allotment within the state. But in PG counseling, now we have this problem that a single candidate might have got two allotments. Most of the candidates would have got single allotment, but there are few candidates who got dual allotments, and that means some of the candidates might not be able to get a seat. Now in this video, let's look at how many candidates have got this dual allotment. How many candidates have got a seat in government quota as well as management quota? Why we need to know this? This will give you an idea that these seats will become vacant for round 2 and you can remain hopeful for round 2. Will this problem repeat in round 2? Yes, it will repeat in round 2, but that cannot be avoided. So I have compared the management quota results and government quota results in round 1, and I found these candidates are overlapping. These candidates have got double allotment. For example, a candidate with management quota rank 32, the same candidate has government quota rank 93. He has got CMC general medicine in both government quota as well as management quota. In government quota, he got under the CMC 20% quota, whereas under management quota, he got under the CMC minority network seat. So naturally, he cannot take two seats, right? He can take only one seat. Whether he will get government quota or management quota, I will explain that. But one of those he has to select, which means the other seat will fall vacant for round 2. Now, like this, how many candidates are getting dual allotment? There are as many as 50 candidates, 50 candidates are holding currently 2 seats. They have to choose between the 2 seats. Some of them may not even choose any of the seats. That's also possible. But at least, right, we can expect 50 seats are vacant. Whether the 50 seats are going to be in government quota or management quota, we don't know. We don't know, right? Because it depends, right? In PG counseling, the specialization also becomes important. Sometimes candidates may not want government quota. They may go for management quota. Now, let's go into a little bit more detail. Let's say, for example, under government quota, let's look at the CMC 20%. Out of the 50 candidates, 11 candidates are Christian candidates. They got a seat under CMC 20% in government quota, as well as they also got a seat in management quota. Most of them have got CMC. CMC, you could see that 10 candidates have got a seat in both government quota and management quota in CMC. Now let's try to find out what seat some of the candidates might choose. Of course, I cannot decide which seat they will take, but I can give you some idea. For example, the first candidate got CMC General Medicine under minority network in management quota, and in government quota, he has a seat under CMC 20%. Now, which seat will he take? Will he take government quota seat or management quota seat? Because he has got the same college, same branch, but only the quota differs. You need to understand, if a candidate joins CMC Vellore under minority network category, he needs to do 3 years service. 3 years service obligation is needed. Whereas if the same candidates joins through government quota, then he needs to do only 2 years service. So most likely this candidate will choose a government quota seat. He may not choose the management quota seat because he has 1 year less service obligation, or as normally candidates call it, 1 year less bond. Whether you want to serve 2 years bond or 3 years bond, government quota, you need to do only 2 years bond. So most likely this candidate will choose this government quota seat. So that might leave 1 seat vacant in CMC Vellore General Medicine under minority network. Most likely this is what will happen. Now the same second candidate, again, if you look at the second candidate, he has got CMC Vellore Gynecology, and in government quota also the same candidate has got CMC Vellore Gynecology. Now which seat will he take? Will he take government quota seat or management quota seat? Now you need to see, this candidate under management quota has got seat under general, CMC General. Now again, if you come to the service obligation, a government quota candidate has to serve for 2 years, whereas the general, CMC General seat, you need to serve only 1 year. So in this case, the candidate will choose, most likely will choose management quota, because he has 1 year bond for management quota, whereas if he goes under government quota, he has to serve 2 years bond. Right? You could see the first candidate and the second candidate, one might go with government quota, whereas the other candidate most likely will go with management quota. So this seat most likely will be taken up, whereas this seat might fall vacant. Whereas in the second case, he might most likely take the CMC General seat, that might leave the CMC Gynecology seat under government quota might leave vacant. Now coming to the third, this candidate has again CMC Vellore, and he has got the same branch in both places. He has got radio diagnosis at both places, and he's got a seat in management quota under CMC service quota. Now this is where there is no difference. Basically government quota also 2 years service. CMC service quota is also 2 years service. So whether he will choose CMC service quota, that is management seat, or government seat, I don't know. It's up to the candidate. He may choose any, because I don't see any difference between the two. But basically that leaves 1 seat vacant in CMC Vellore for radiology. But whether it is government quota or management quota, we don't know. The next candidate gets CMC Vellore under MD Pediatrics, whereas the same candidate also got MMC Gynecology. Once again, the next seat, this candidate is getting Karpaga Vinayaga Radiology under management quota, whereas under government quota, the same radiology they are getting, but in Dhanalakshmi Srinivasa. If I am this candidate, most likely I will go with the government quota seat, because both are private colleges, Karpaga Vinayaga or Dhanalakshmi Srinivasa, both offers radiology. I personally will choose the government quota because of the fee differences. Government quota fees will be much lower compared to management quota. But again, it's very difficult to find out which seat this candidate will take. Right? So that's how you have to look at it. There are a lot of candidates having the same college or same branches allotted in both, but which they will take, yeah, it's very difficult to find out. So we have to wait and see which the students are choosing. For example, this candidate gets PSG, they get MD Pathology in management quota, whereas the same candidate gets MD Microbiology in PSG. So if they want PSG, yeah, it doesn't matter, they can join government quota, but they are more particular on the branch, then they have to choose whether they want pathology or they want microbiology. That's something they have to find out and then choose the seat. We cannot determine too much from here. There are about 50 seats vacant. As I said, some seats we can confidently say the candidate will go with the government quota seat. Some seats we can confidently say they will go with the management quota seat, but most of the other seats, it's very difficult to determine where they will go. For example, this candidate gets PSG respiratory medicine and Karpagavinayaga general medicine. If I am in this candidate's position, most likely I will prefer a government quota seat. Why spend so much unless, right, they specifically want respiratory medicine? Yeah, I do not know, but you have to choose. And again, this candidate is getting general medicine in Tagore under management quota, whereas he getting general medicine in Karpagavinayaga and government quota. Certainly, I will go with government quota. If it is the same branch, but two different private colleges, why spend a lot of money on the management quota seat? Rather, take the government quota seat and then try to upgrade in round 2, try to upgrade in round 3. Right? There is a possibility for you to move to a better college if you want, or if you are happy with Karpagavinayaga, you can stick to that. One thing you all can be confident is we are going to have 50 seats vacant. How many in government quota, how many in management quota, we will know only when the round 2 seat matrix comes up. So I hope this information gives you some idea about the vacancies that might arise in round 2. Thank you. Bye-bye.